Hi, I'm Mary Beth Stapleton, Manager of Family and Community Partnerships for Harford County Public Schools. Thank you for joining us today for this session of Parent Academy on returning to in-person learning safely. We're going to talk this few minutes around how do we make sure that our children are prepared to return to in-person learning, and how do we as parents get all these questions answered about what is safety going to look like for our students. With me today, I have the Acting Director of Clinical Health Bureau for the Health Department, Ms. Lynda Boegner. Hi, Lynda. Thanks for joining us.
Hi, Mary Beth. Thank you so much for having me.
Well, and Lynda's out and about in the community all the time, trying to work with our partners and our parents and our organizations and schools, and really just giving us some guidance on what does it look like to be as safe as we can be right now with the COVID-19. So thanks for joining us.
Thank you.
To get us started, just again, I think we had a conversation a few weeks back when we were talking about the learning support centers. Now that we're returning to in-person learning, what are some thoughts around how we're doing as a county with the COVID-19, and how are we progressing?
Definitely. We'll touch on that today. So the numbers in Harford County look pretty good right now, as we heard from the governor just yesterday in his press conference. But Harford County right now, the positivity rate is about 2.94, and the new cases is about 6.88 new cases per 100,000. So the numbers look really good, but it's very important that we bring up this topic of safety, especially as we're on the cusp of reopening schools, as we're right on the edge of cold and flu season. So it's very important to kind of talk about these issues. I just want to encourage everybody to just remember all those mitigation, preventative, protective strategies that we've been talking about for the last several months now. The 6 feet rule, the social distancing, the staying home when you're sick, trying to avoid sick people, washing your hands with soap and water, using sanitizer if you don't have the soap and water, getting your flu shots, but just as importantly, wearing your mask. So there was actually a study that showed that somebody had sneezed in the grocery store, and that respiratory droplet, it took less than 1 minute for that droplet to get to the person's nose in the next aisle. So it is something to worry about. Breathing, as you might know, breathing, sneezing, coughing, all those things potentially can spew respiratory droplets into the open space, and they can travel 6 to 14 feet away into the surrounding areas where people might be, and that could potentially infect many, many people. So the mask serves as a barrier, as a kind of a protective barrier that will catch some of those droplets and keep things from spreading. That being said, though, all masks are not created equal.
And that was my question, right? Because we do, and as parents, right, we're running out the door.
Exactly.
And we don't necessarily know where the mask is.
Right.
And maybe we'll grab a bandana or grab something we see in the house and be, okay, let's just grab that.
Right.
But I do think that we need to have a really clear conversation with parents about what are we talking about when we're talking about face coverings, right?
So I wanted to bring all like hands-on masks with me, but I couldn't get all the different brands. So I brought some pictures, which I'm going to share with everybody.
Oh, great.
So kind of this is that traditional surgical mask that we want to really leave these for our healthcare workers, our providers, first responders, because they are a little bit in short demand. So these mainly are for our healthcare workers, and they do protect the spread. They are a good barrier for that. But mainly what families are probably using these days, and what CDC recommends just for everyday use, is the face coverings, just the standard cloth face coverings. And CDC does recommend like a 2 to 3 layer, so you might see people putting these cloth barriers in between too, just to add that extra layer of protection.
Yeah, and our HCPS masks have that place where we can put an extra layer, so that's good to have, right?
You do want to wash these though daily if you can.
Okay.
So that does tend to kill any virus that might be sitting on top of that cloth material. So this just kind of shows somebody wearing it effectively, nice over the nose and over the chin. I have another picture to kind of illustrate that as well. This is a version that's out there now, the clear mask that some people may have seen. Lots of teachers are choosing to use this.
Teachers.
Especially if you need that visualization of the mouth for kids maybe with disabilities.
And that's an appropriate mask choice.
Okay. Yep, it's over the nose, over the chin, so it's perfect.
And you can see the mouth, which is nice for teachers.
Yeah. This you might see out there too. This is mainly for the healthcare workers, the N95, so very effective at blocking aerosol spread and viral transmission, mainly for healthcare workers though. Face shields. You might hear a lot about face shields. A lot of people think this is a great substitute for the facial covering or the mask, but this should be worn in collaboration with the face mask, because if you look down in here, it leaves a lot of open air underneath the chin. So theoretically, all those particles can travel out beneath that and spread to people in the surrounding area. So this serves as great eye protection for people wearing it, but it should be used in collaboration with the mask.
And that's a really good one to note, because I think we're seeing, as parents are watching perhaps football games and such like that in the NFL and other venues,
Right.
they're actually, some of the coaches are actually just wearing the face shield, but they're not wearing a mask underneath. So you really do
Exactly.
need to have both.
There is one version, which I haven't seen in person yet, that kind of sits like a hood that kind of covers the whole area, sits on your shoulders. That probably would be acceptable because it closes that area.
Okay,
But-
but it's about closing that
Right.
bottom area too.
exactly.
Okay, good to know.
A couple more to go through. These are respirators, very bulky, cumbersome. Might see these in the hospitals too. Hopefully people in the grocery store aren't wearing these, but you never know. Absolute no-no. This is a mesh mask. I've actually seen lace versions of these in the grocery stores. So this obviously is letting all those respiratory droplets out into the surrounding area. So this is definitely a no-no. And these, this is what you were talking about, Mary Beth, at the sports. John Harbaugh, I think, was actually wearing a gaiter.
Oh, I did see him, yes.
The other night. These, CDC does not recommend these right now. They're still studying them, so they haven't said like a definite no to these. But because they're so thin and porous, a lot of virus, potentially droplets, are getting out through these. So these are not recommended if you can get hold of a mask.
Good to know.
KN95, similar to that N95 for healthcare workers that I had listed before. This one is not super recommended right now because many versions of this came from China and it was not FDA approved in the United States. There are a couple versions that are acceptable. They would be on the FDA site if anybody wanted to Google those if you have to wear these in your workplace, but definitely do your research before wearing these. And here's that kind of bandana we talked about too, similar to the gaiter. Lots of open air here, so potentially viruses coming out underneath the chin. So first choice would be the cloth mask. Probably better than nothing, but still not optimal. Here's the mask many of you may have seen with the valve. These are definitely not recommended by CDC because while it might protect the person wearing the mask, that valve is actually letting droplets out, potentially infectious material out into the surrounding space. So that could be infecting vulnerable populations that might be around you.
So just to interrupt you for a second, for that valve, I see in some cases there's actually a filter you can insert, but still that's just not as safe, correct?
Right,
Okay.
correct. Yeah.
Good to know, thank you.
These are mainly used for environmental, protecting from chemicals and dust particles and things of that nature, not so
Okay.
much for respiratory droplets. Just to kind of reiterate how to wear a mask, we want to make sure they're over your nose and chin, kind of snugly up against the face. You don't want it around your neck. You don't want it on your forehead. We tend to see sometimes children doing those things and even adults.
Well, and again, as a parent, I'm seeing in my child's circles of teenagers, right, that they're kind of wearing them in some cases down here.
Exactly.
The nose is exposed.
Right.
That's not something we want to tell our children to be doing.
Right. Lots of
Please
droplets
make sure.
coming out of the nose too.
Yeah,
so
yeah, and
definitely.
I think they just do that because it's starting to become comfortable and
Yep.
more comfortable than having both covered.
For sure. Just a little picture of the children wearing the masks. They're doing an awesome job wearing these masks, and I think it's because they're looking at their teachers, their adults, their parents, being as wonderful role models. So they're doing a great job, and we just as adults have to kind of keep encouraging that, and hopefully they'll look to us and continue to wear the masks. And I did just want to bring this up in case anybody wants to put this on their Christmas list. This is a mask of the future, and this version actually is coming out probably by the end of the year. So it's a rechargeable air filtration system inside, and you can even get versions that display messages on there too. So
Oh,
if
wow.
you're not particularly fond of somebody, you might want to put that up there as well. So.
Wow, that's a great list of information and
sure.
resources and what we should and shouldn't be doing for sure. That's very helpful.
And I just wanted to finish up and say that masks are most effective if everyone wears them. So it protects us, it protects the people around us. And the decision to wear a mask truly is just an easy step we can all take to protect our families, ourselves, our schools, and our communities. So,
and that's what we want to do. We want to protect our children, our staff, everybody coming back into the building and making sure. That's really helpful information. Thank you so much for being here and for helping our parents understand what this looks like and to get prepared over the next few weeks. So thank you for your time.
Thank you.
Our next guest is Ms. Mary Nasuta, our Supervisor of Health Services for Harford County Public Schools. Thanks for joining us, Mary.
Thank you so much, Mary Beth.
So Mary's been very, very busy helping her staff and all of us get ready for a return to in-person learning while managing the Learning Support Center. So lots of work going on there. So Mary's going to do a little bit of a deeper dive into what do masks look like in the school setting, safety in general look like in the school setting as we return our little ones back to school. So Mary, to get us started about the face coverings, thinking about the different sizes as a parent, should I be thinking about a size for my child returning and making sure, because let's face it, as parents right now, we may have had our children wearing masks for a little while in a grocery store or, running here and there for errands. But we're really talking about a full day, right? That's the expectation. From the time they get on the bus to the time they get home to you, they will have a mask on, correct?
Correct. Okay. I mean, there are some times where we're taking masks off, obviously, to eat.
Okay.
Outside, if we're playing and we can have social distancing, they would be taking their mask off at that time. But it is an extensive period of time. So I think the first thing that parents need to think about is just fit and comfort. So when you think about, one of the things we've noticed, even with adults, are that there are so many sizes of faces and shapes of faces and different ways that ears are set, and it can all matter. So what might be comfortable for me may not be comfortable for you. So when we think about child-size masks, this is an adult surgical mask that you've all seen. Well, this is the child size, and you can see how much smaller it needs to be for our elementary school kids to really get a good fit. And when we think about fit, we think of the nose, obviously being covered, also both sides without any gaps, and then under the chin. And these are sometimes the parts that are difficult to get the under the chin. And that's why masks are pleated, so that they can go under the chin. So there are lots of places to get the right size mask, Amazon and all the online stores, and even out in our regular department stores, they have masks that are for children. And I would suggest getting the right fit. It's taken me a while to find the right fit. So keep trying. It might be that what fits for one child doesn't fit for another. So let's look at first the size and then the comfort. Because the longer you have to wear it, the more you really want to feel comfortable in it. And it's a long day. So the next part, so we got our fit and comfort, the next part is that role modeling. And children do imitate what we say and what we do. So even just the way we present this can be very important. Not to have that sort of, oh, here we go again with this mask thing. I mean, to really understand that masks, as I think Lynda did a great job, are source control. The source of the virus is our respiratory droplets. If we can control the virus at the source, we can really make a really big difference in helping the health of our community. So being a good role model also involves practicing. And I think you really hit it on the head with the idea of we've been wearing them for 15 minutes in the grocery store. But wearing them for hours can be hard. So we have to practice. I've heard from some parents who have kind of instituted when you're on your iPad, you need to put your mask on just to get used to wearing a mask for a longer period of time. And they're doing it too. So the more that we can practice that, the more likely we're going to be successful at it. And then just normalizing masks. And that's hard. And I understand why people have trouble with this, because back in February, we were telling people, don't wear masks. And the science has evolved. The science does. It doesn't stay static. And so we know now that masks are important for source control to keep us all healthy. And so some of the things you can do to normalize is obviously to put masks on all the stuffed animals and your dolls and all the rest of it for the little guys. Teddy bears do not fit well in masks because their ears are on the top of their heads. So that's a good example of all the gapping that can happen. You can talk to your children about that. Involving your child in selecting their mask, finding their favorite color or a storybook character that they like or a superhero. Because I think just like we're picking out our first day of school wardrobe, we're going to be adding the mask to it. For older kids, it can be sort of a fashion statement. I do see kids who match them to their outfits. But the most important thing is that kids are involved in the process so that it's not something that's thrown at them, but they're sort of a part of it. And praising kids. doing a great job with wearing that mask. I think that in addition to role modeling, kids really do want to hear from their parents about what a good job they're doing with their masks.
For sure.
So
Yeah, and just thinking about, so helping them also, so once they have it on and they've found the right mask and they're feeling comfortable, there might be times throughout the day that they have to take it off. So thinking about that with the safety around taking on and off a mask, what's the best way to do that?
Well, I'm glad you asked, because that has been a real problem for people, because you have to think about the fact that the outside of your mask could be contaminated with a virus. Now, I don't want to make people sort of so afraid of that, but there's just an easy way to do it. Whenever you use your mask, you put your mask on or off, you should be handling it by the ear loops or the ties. And then when you take your mask off again by the ear loops and ties, you want to avoid touching what we call the T-zone, which are your eyes, your nose, and your mouth. And then you'll just take this mask and put it inside out. And it's easier when you know that there is a mask that has one side and the other. So it's important that if it doesn't look like it has one side or the other, that you mark it as front and back.
Yeah.
And I'd also suggest putting your child's name on it, too.
Well, and again, just thinking of, we're doing Parent Academy Real Talk here, right? So as your child comes off the bus, or your child gets out of your car and gets into the house or walks home, you know how they do, right? They dump their backpack, they dump everything, they dump, right? And so in this case, they'll probably throw the mask on the food counter, or throw the mask on the dining room table. That's not what we want to do,
It can be hard.
right?
We really want to try to get to that kind of normalizing this idea that we hold it by the ear loops, we turn it inside out, and it gets washed.
And it gets washed.
And
So
it
put
gets
in a safe
washed
place.
every day. And
Got
I
it.
know that can be really tricky. Sometimes people will get used to a particular mask. They don't want to put it in the wash. It should be washed on the highest level that the fabric will allow. So washing it on warm or hot.
Okay.
It should also be dried in the dryer the whole time. And if you're like me, you probably take a lot of stuff out of the dryer early so it doesn't wrinkle. This will wrinkle and you may have to iron them. But again, that heat is going to help to get rid of any virus or bacteria that could be on the mask. So
Okay.
it's important. We often will say that we treat our masks sort of like underwear, and some of my nurses have done some great bulletin boards on this. But they have to be clean. That's really important. You have to not share them, obviously. If they start to wear, you need to get rid of them. You shouldn't adjust them in public. That's the idea of trying to keep your hands away from your mask, which can be really hard, especially when you're talking. And they should fit snug, but not tight.
Right.
And so that's something that when you get the right mask, and I think that's why it's hard to get them washed, because you're like, this is the mask. And I really like this one because it does have the chin that's covered nicely.
They got the filter inside.
Right, and that couple layers is nice. More layers is better, and as long as you're able to comfortably breathe. So, I understand where people are coming from, where they don't want to wash, but they do need to be washed every single day. So you need to have the 5 for the 5 days if your child's coming 5 or 3, but you also need to be packing some extra. So I do suggest a Ziploc bag or a pencil case or something that you can put an extra mask in for the day. So once you put that mask in with the child's name on the bag and on the mask, and knowing which is the front and the back, you can pack that with your child's belongings in their backpacks.
Oh, okay.
Really
I didn't think about
important.
that extra mask situation. But we all know
They
days
will.
get busy, days get crazy, and so a mask might be forgotten.
Absolutely.
So what happens then for our children when that
So we
happens?
do have extra masks within the health suite. We got some of the cotton masks that you'll see that they can have to take home, and we are going to be helping families who might be struggling to get extra masks, so just let your school nurse know. We also have some thermometers for families who have needs or are struggling, so they can take their child's temperature every day, because we know that's a really important measure to make sure that kids that are sick don't come into the school building.
Well, and if we could touch on that, now that you've mentioned the temperature check, so there's a letter that we're signing.
Right.
As a parent, we're saying, I am checking my child's temperature, correct?
That's correct.
Okay.
And, I've gotten used to this summer. I have a thermometer that's out on my countertop. As I go out the door, I check my temperature. It's kind of an unusual thing to get used to, but now that I'm used to it, it's sort of like it feels weird if I don't pick it up. So that's going to be something that'll be a little difficult to get used to at the very beginning, but it's so important, because if we can keep sick kids home, we can keep the community healthier.
Right. In addition to the temperature checking, if we see other symptoms as a parent in the morning or the evening before school, when their day is to, we have 1 day a week to start, right?
Right.
So your day is coming up and you're starting to see some symptoms. I'm guessing we should err on the side of caution?
Absolutely,
Okay.
absolutely. And I know that there have been concerns about sort of what symptoms are COVID and what aren't. The fact is, if you're not well, you should stay home. So the same symptoms that you would look for your child, nausea and vomiting, headache, stomach ache, sore throat, cough, all of those things, child should stay home. And if you are in doubt, our school nurses are there and can help you to talk through that in the morning too.
Right, and then they could probably still participate in some learning during the day.
Absolutely. That's the really beauty of
Yeah.
the virtual setting still being available.
Yeah.
Is that, yes, it would be sad to miss your one day, but you wouldn't be behind in your classwork.
Great, great. Well, very good to know. So after, we have children taking their masks off here and there throughout the day, but is there ever a situation where a child will not be in the building with a mask at all? Like, will there be a child who won't have a mask on?
There are rare exceptions to the mask rule, according to the Maryland Department of Health, and they talk about children under the age of 2 not wearing a mask, or those with developmental disabilities, or people who couldn't take the mask off on their own. So that obviously we wouldn't want to put a mask on a person who couldn't take their mask off. And those are sort of the rare exceptions that we have. You can talk with your school nurse if you're having trouble with having your child wear a mask. We certainly can help them to do that. But this idea that there are diagnoses, or there's not any really one diagnosis that would say, well, no one with this could wear a mask.
Well, yeah, and I'm just interrupt you there for a second because I'm hearing the word exemption.
Yes.
Right? How do I get an exemption? Is there some kind of legal document that I can share to say I am exempted, right?
Right. So we have the mask guidance from the Maryland Department of Health lists those sorts of exemptions, and they are the developmental disability, the children under 2, people who can't take their mask off or have difficulty breathing.
Okay.
Those are the exceptions to the mask wearing rule. But again, they're rare, and we really want to try to ensure that as many people as can wear masks do, because my mask protects you and your mask protects me. So never before, I think, have we seen so strongly how your health affects my health and my health affects yours.
Absolutely. HCPS together, for sure. And that's where we are. And so if a parent has a concern about one of the situations you just described, they contact their school nurse?
Yes, contact their school nurse. We can help them to develop a plan. Obviously, we're going to then, of course, try to do our best with distancing. But we know there are going to be challenges, and we're learning each day how to meet those challenges. So we're certainly ready and willing to work with any parent who calls us to help them create a plan.
And then once we get into the building and we've got our masks on and things are rocking and rolling, are they going to have chances throughout the day to wash their hands?
Absolutely. That's going to be a big part of how we're structuring the day. So washing hands when we get in, washing hands, of course, after bathroom use and before eating. We're going to be stressing that all day long. We have a lot of hand sanitizer ready. We're also going to be using soap and water in our bathrooms, and we're going to be really stressing with kids what 20 seconds is. So a lot of singing of happy birthday or the ABCs or counting to 20. We've got some other songs we're putting together too, because I think we're getting sick of the whole ABC and happy birthday. But I really do think that'll be a very big part of our day, is thinking through that and making it more automatic. And this is something just like mask wearing that takes time, but the more we can make these things more automatic, the healthier we'll be. Great.
And again, something that parents can practice in addition to the mask wearing is the hand washing with our little ones and monitoring that a little bit. So that's good to know. So unfortunately, I do know that there could be a situation where a child or a staff member has some symptoms of COVID, and no matter all the wonderful things we're doing, there could be a situation where some symptoms arise. What is happening if there is a symptomatic child or staff person? What's the procedure?
Well, this is where we're so fortunate to have a nurse in every building, because the nurses are managing this. They're going to be using the decision aid from the Maryland Department of Health to determine if this is COVID-like illness. If there is a COVID-like illness, then they will look to close contacts to also consider them going home. So the child who's sick gets isolated. We call that for the people who are sick to be isolated. And then the close contacts are quarantined. And we quarantine people who might have been exposed to someone who is sick. So the close contacts in younger grades will probably include a lot of the class, just because the distancing is going to be more difficult for those students, especially in kindergarten. But as we go into other grades, we may find that their classroom has been able to maintain their distancing and masking, and so there'll be very few close contacts that would need to go home. And that's our hope, to really decrease the disruption in the school.
And that's going to be used, the nurse in the building will be the one working
Absolutely.
with
She'll
support
be
of
making
you.
that decision, and she'll be letting them know how many days and all the rest of it. As we talked about in an earlier episode, in order to kind of get out of quarantine, and that's what people want to know, how do I get out of quarantine? You have to have the person who is sick, the person with COVID-like illness, either test negative, which would be lovely, get another diagnosis from a healthcare provider that explains the symptoms that they had, or we have to have 14 days elapse.
Okay.
And the nurses are keeping count of all of that and keeping all of our data.
And again, if they are unfortunately quarantined, they still can participate in learning at home. So that's again the beauty of the virtual instruction.
Yeah, absolutely is, especially in this time where we know that there are going to be disruptions.
Right. And we want to focus on that progress for learning for sure, as parents always is what we want to do. Well, this is great information, and thinking about as we go through the fall and that we have the nurses there and supporting there, is there also support with the health department? I mean, are you working with the health department?
Absolutely. Every single day,
Boegner?
Lynda and I are talking,
Yeah.
or someone from their communicable disease nurses are talking with us. Our nurses are actually talking directly with the health department too if they have questions or they're working through something on the Maryland Department of Health decision guide that they'll call them directly to. So we have lots of conversations. We're also working with them on flu clinics. We're going to be giving flu shots at the learning support centers beginning of, next week, I think we start. And then we also have a very nice clinic that's going to be at Patterson Middle High School on October the 10th. And all that information is available on our website. And so anybody K through 12 can get their flu shot there. So we know that flu shots are going to be really important.
Right.
Because we don't want to confuse COVID and flu, and they have a lot of similarities in their symptoms.
Very good, very good. Well, this is all great information, Mary, and we appreciate your time. I know that this is it's just weighing heavy on the hearts of parents right now as we think about going back and really, we hear all kinds of different things and stories and see things in social media, but from hearing from the expert who knows that, you're in charge, your staff's in charge, you got it under control as best you can, and we're just going to keep learning forward together. So this is great. Thank you so much.
Well, thank you so much.
And just remember, everyone, that we are HCPS together. We're here to help. We're here to support. And we really appreciate your time. And as we always say in Parent Academy, HCPS parents are our children's first and best teachers. Thanks for being with us today.